Assalamualaikum and hello everyone. I am Asrinah Binti Muhammad Saleh and my partner is Nadzlina Binti Mohamadjid. Today we are going to present question 12, which is employee participation practice in the context of safety and health commit in Malaysia.
Employee participation in the context safety and health committee. Situation in which workers are active in a business organization's decisions making on safety and health problems is known as employee involvement. Management will strongly encourage employee participation as it ensures control of safe behavior at the execution level where it is most necessary. Employee engagement can take several forms. There may be through participation or through safety circles that meet in small groups on a regular basis to discuss ways of improving safety and health issues. OSH participation involves the sharing of relevant information about OSH and welfare with employees, giving employees the opportunity to express their views and to contribute to the resolution of OSH and welfare issues, and valuing the views of employees and taking them into account. Participation allows workers to contribute to decisions affecting their safety, health, and well-being. This allows employers and workers to work together in the hunt for solutions that can lead to better and healthier jobs. Type of involvement of employees can depend on the size of the organization. Participation by employees can take place through three methods. First, OSH committee, where employees are elected to an OSH committee. Second, OSH representatives are elected by other employees of the business. Third, other agreed arrangements such as holding regular staff meeting where employees have their concerns considered by employer. OSH could be made a regular agenda item. Holding specific OSH meeting when concerns are discussed. Holding toolbox meeting, which are informal meetings where the employer and employees can discuss OSH concerns and issues. Training on all aspects of OSH, including emergency arrangement associated with their work. Under the Occupational Safety and Health Act 1994 provision, an employer of 40 or more individuals or under the control of the Director General must set up a Occupational Safety and Health Committee. The principal role of the committee is to keep the steps under review taken to ensure the health and safety of people at work and to address any relevant problems such as complaint and accident that occur. Consultation and cooperation between the employer and the committee on matters of safety and health shall always take place. Safety and health is the security and promotion of workers' health by preventing and managing occupational disease and injuries, and by removing occupational causes and conditions which are harmful to workplace health and safety. In the Health and Safety in Employment Amendment Act, requirements for employee engagement are rationalized on the basis of unitarism, which means that employers and employees have common value and should work together to achieve higher levels of health and safety management. Collective bargaining arrangement must strengthen the statutory powers given to representatives of the protection and health of employees in terms of their relationship with trade union and work councils, their election or appointment, their roles and responsibilities, and their effect. The commissions and members differ. They were most active in becoming an integral part of the safety and health system of management, providing access to appropriate information involving rank and file staff in their activities to help ensure continuity and being backed up by effective government labor inspection. Representative of the health and safety of workers necessarily enjoy protection from discrimination or retaliation in carrying out their duties. We are entitled to at least some time off with compensation, as well as having the requisite means to exercise their duties, the concept of which is often debated. The worker-employee interaction circle is a very necessary part of OSH. Employers can find it incredibly helpful to speak to their employees about issues, try and listen to their advice, and ask them for information. OSH operates best if everyone is actively involved in their production and implementation, including management and employees.
Okay, next, employee participation practice in the context of safety and health committee in Malaysia can be referred through Act and Regulation enforced those. The first one is Occupational Safety and Health Act 1984, Act number 514 and 7 regulation thereunder. The second one is Factory and Machinery Act 1967, Act number 139 and 15 regulation thereunder. The last one is Petroleum Safety Measure Act 1984, Act number 302 and its regulation. There are some employer responsibility for safety and health at the workplace for their employees. From Occupational Safety and Health Act 1994, in Section 16, employer need to provide safety and health policy in writing. Next, in Section 15 in bracket 1, employer need to provide organization safety and health arrangement. Next, employer need to ensure the best practice safety, health and welfare of their employees. And the last one is Section 15 in bracket 2, procurement and maintenance of plants and work system. Make arrangement for the safety and health of the use, handling, storage and transportation of plants and material. Provision of information, instruction, training and supervision. Procurement and maintenance of workplace are a safe and risk way to enter. Provision and maintenance of a safe and unsafe work environment and adequate welfare facilities. Okay, next, as an employee, there are some responsibility for safety and health at the workplace. For the first one, they have to work safely to ensure their own safety and health. They also have to make sure their action not cause injury or harm to others. Next, follow employer instruction on safety and health or ask for assistance if do not understand the information. Employee also need to take care of any protective clothing and equipment in the way they have been instructed and report any concern about it. Employee also need to report any hazard, injuries or ill health to supervisor and employer. The last one, cooperate with employer when they require something to be done for safety and health at the workplace.